All right, back now with you here on the KFYR Plus News Desk. And America's healthcare costs continue to soar, burdening families, seniors, and small businesses, even as large insurance corporations post record profits. Today, we speak with Wendell Potter, former insurance executive turned whistleblower, to help unpack why Americans pay more yet receive less from their coverage. Mr. Potter, thank you for your time today.
My pleasure. Thanks for having me on.
So, why are families paying more each year in premiums, deductibles, copays, and other out-of-pocket costs while insurers now are collecting record revenues and profits over the last several years?
Two words: corporate greed, and the fact that insurance companies have changed a lot in the last few years to the point that they are now part of gigantic corporate conglomerates like United Health Group, which is the third largest company in America. Only Amazon and Walmart are bigger in terms of revenue. Cigna, where I used to work, and Humana are also much bigger than they used to be because they have gotten increasingly uh, into healthcare delivery as well as health insurance. They all are also traded on the New York Stock Exchange. These are for-profit companies
Mhm.
that are controlled largely by Wall Street and have to account to their investors more than their patients and the doctors who deliver the care for us and the hospitals. So uh, our our health insurance industry has changed remarkably, and they have gotten more and more greedy and have to, their first responsibility is to meet those shareholders' expectations. And that is, as you noted, causing a great hardship for our seniors, for small businesses, for farmers, for all of us. The average cost of a family policy now is $27,000, which you can get a new car for that. And
Mhm.
that's what we have to pay every single year.
How has consolidation among insurers and even pharmacy benefit managers and provider groups changed the competitive landscape?
Yeah, this is a relatively new development. Cigna, where I used to work, used to be largely known as a health insurance company, but a few years ago, it bought a company called Express Scripts, which is one of the big pharmacy benefit managers. It's the middleman between a drug maker and a pharmacist, and they figured out how to extract so much money from the pharmacy supply chain. Here's an example. In 2024, Cigna brought in over $240 billion in revenue uh, from the division that includes its pharmacy benefit manager, Express Scripts. That's more money than Johnson and Johnson, Pfizer, and Eli Lilly collectively together brought in revenue. So these companies have figured out how to make us pay more and more for our pharmaceuticals and more money out of our own pockets when we go to the drugstore.
Can we talk about the 80/20 medical loss ratio rule? What should consumers understand about that 80/20 medical loss ratio rule, and how do insurers still find ways to game the system?
Yeah, that's a law that was put in place about 15 years ago. Before that, insurance companies were paying less and less every year for our health care, regardless of how much we paid in premiums. It was down to about 50% in some cases. But to get around this law, these companies have got more and more into healthcare delivery, and that's because physician practices and the pharmacy space, that medical loss ratio provision doesn't apply to them. So what these companies have done, they've bought physician practices. United is now the biggest employer of doctors in the country. Three of these companies, Cigna, United Health, and CVS, which also owns Aetna, they control 80% of the pharmacy benefit market in this country. So that is an enormous amount of money that they are able to get from us. They're also again, keep in mind these are middlemen, but they're also robbing us as taxpayers. United Health and these other companies are getting increasingly into the public programs, into Medicare, Medicaid, even the VA. United last year took more than 75% of its health plan revenues came from us as taxpayers. So even as they are charging us more for our private insurance, they are charging us as taxpayers as well. They're really robbing us blind.
Mr. Potter, CEOs from the largest health insurance corporations have been called to testify in front of Congress tomorrow. What should Congress be asking these CEOs during this upcoming hearing?
I would ask them, uh, to justify their existence. We've given them decades to show that they can reduce healthcare costs and make sure that we get the care that we need, and to hold down the cost of coverage and healthcare. They have not done any of that. In fact, the cost of healthcare goes up every single year. There has never been a year that we've paid less for our health insurance since these guys have been running the show. They've gotten increasingly in control of our healthcare system from cradle to grave. I would ask them to justify their existence, how much money they're making. My former CEO at Cigna, David Cordani, is going to be one of those folks. Over the past 5 years, he's made over $100 million in salary that we know of. They use so much of the money that they take in from us to buy back shares of their own stock. Cigna, in that same time period, used $30 billion to buy back shares of its own stock. And that does nothing more than to benefit David Cordani and his colleagues and shareholders. I would hold them to account. I would ask them, why are you guys even able to do business as you are? And by the way, there is call on both sides of the political aisle, Republicans as well as Democrats, calling for the breakup of these companies, and I think that's in order.
With the final few minutes that we have left here, sir, what are your thoughts on the President Trump's great health care plan? Have you had a chance to look at that?
I have looked at what he has said. There aren't many details, just a few paragraphs so far, but it looks like he's suggesting that, and in fact, he said, let's give people money directly. That's frankly, we'll see how he fleshes that out, but I can't see how that's really going to make a difference, because even if you give it to us directly rather than directly to insurance companies, we still have to pay insurance companies with that money for our coverage. And a lot of folks, Republicans, have talked about let's put that money in health savings accounts. If you are a low income person, you're not going to have much money to do that. And so the devil is in the details. Let's see what he comes up with. But he has, to his credit, called these insurance companies big, bad, money-sucking companies. And I certainly agree with him about that.
Yeah, I mean, correct me if I'm wrong, but in 2017, didn't the Trump administration take out the CSRs in Obamacare, and now they just want to replace those same cost-sharing reductions? I mean, did they break it to try to fix it?
It's a good point. Yes, over the years since the Affordable Care Act was passed, Republican Congresses have weakened the law, and they have taken some of those cost-saving reductions out of the equation. But keep in mind, health insurance overall has just become completely unaffordable, whether you're getting it through the Affordable Care Act, through Obamacare, or through your employer. How can a family, an average American family, afford $27,000 for the average health insurance policy without somebody helping to pay for it, without either your employer subsidizing it heavily or the government subsidizing it? We just can't afford it. This is ridiculous. We can't afford to keep going on this way. And there's no reason for us to think that next year these companies are going to figure it out and change the way they do business. It's just not going to happen.
Former health insurance executive and policy expert Wendell Potter, thank you for the insights today.
My pleasure. Thanks for having me on.
You got it. 9 minutes now past the hour. Let's take a break. We'll be right back here to KFYR Plus.